Hi, and welcome to And So Much More. I'm your host, Cami Smith, and I am here with Dr. Audrey Graham. Audrey, thank you so much for being here. Should I call you Audrey or can I call you Dr. Graham? What do you think?
Dr. Graham.
Okay, Dr. Graham. So Dr. Graham is here because it's the month of October, and whether you're listening to this in October or you're coming back and you're listening later, we want to shed a huge light on breast cancer awareness. So breast health. And I love that approach to it because I think people don't often seek help until something's wrong. But we want to stay in a healthy place. We want to maintain a healthy place. And so we are going to talk about preventative. We are going to talk about mammograms. We're going to talk about how to even decipher all of the things, because maybe you're going to go get your first one. Maybe you've put off getting your first one and it's time. And so hopefully we can put your heart and your mind at ease a little bit. So first, tell me a little bit about yourself.
I am a radiologist, fellowship trained in breast imaging, and I've been here at Centra for over 14 years.
Oh, wow. Have you always been in breast imaging?
I have always been in breast imaging.
Okay. What made you choose that?
Well, I really like women's health and women's imaging, and I've always been interested in advocating for women.
Yes.
So
it's important for these women to have someone who wants to represent a voice of health for them, because I think a lot of times we don't prioritize our health. There's a lot of other people around us who need taken care of, or maybe, it's just not something that you know to do yet. So how would you even begin the conversation of breast health?
Yeah, I think that's a great question. And I think that women are natural nurturers, caretakers, and tend to kind of put themselves second.
Yes.
So as far as October, it's so great talking about women's health and breast health and what women can do to screen for breast cancer, which is very common, and then what they can do also just with maintenance and taking care of themselves by doing physical exams monthly and just being aware if they have any symptoms to go seek help.
Yeah. How do they know what symptoms should lead to actually seeking help versus just something that maybe feels a little abnormal?
Yeah, that's a great question. So, of course, pain is what most people come and see us for. The other thing is something that they might feel. Their exam might change. It's something that at any age, it's important to just pay attention to your own physical exam and how you're feeling, and if you notice a change, to go and try and get some answers, whether it's your breast or if it's any other medical symptom or complaint.
So as we are talking about breast cancer awareness, but also breast health awareness, what are the first steps? Like for someone, like last year, I got my first mammogram and I didn't even know who to call or where to go, and so even just getting the ball rolling, thankfully working at Centra, there's so much education available to me, but there's also so much education available to our community. So how would you advise somebody for that day one appointment or how to even set it up?
Right. Yeah, those are all really good questions. So the incidence of breast cancer is high enough that we screen women that don't have any symptoms.
Yeah.
And we start screening at the age of 40 and then every year. So once you get to 40, you should be getting yearly mammograms.
Yes.
The thing about doing mammograms is that we're trying to find something early. So if someone does develop something, we want to find it at the earliest, smallest stage so that the treatment is easier, your risks are much lower, and you have many more treatment options.
Yeah. Okay.
And often treatment is not as aggressive when we find it early. And that's what's heartening about working in this field, is that most breast cancer patients do very well. And yes, they do need treatment, but we see them for years and years afterwards.
Oh, I love that. So you develop a lot of relationship with your patients.
Yes, we do.
Yeah. So we are following up with this episode after having a conversation with Luann Hunt, who is a breast cancer survivor who has turned into an advocate which I think is amazing.
It is.
She's kind of carried her story forward and is using that as a platform. And so do you see that a lot with your patients? I mean, I know that you go through something and it changes you on such a deep level, but what do you think? Was there anything different about Luann's story from a clinical perspective, maybe seeing her kind of propel forward?
Yeah, I think it's really wonderful that when you face a diagnosis, kind of how you approach it, your support system, your own system of beliefs, kind of factor into that. And as far as how you kind of go through that journey, and many women do become advocates, whether it's the rest of their family to get the rest of their family screened with their friends. What's so wonderful about patients that go through this is that they can share their experience so it's not as scary for other women that may be facing similar situations.
Yeah. Well, I know that her work is definitely changing lives. Some of you have seen that, have been a part of that. But also your work, and you're bringing education to the table as well. And so I do have very specific questions about like, what is the difference between a 3D mammogram or is it an ultrasound?
Breast ultrasound.
A breast ultrasound. What are the difference between all the different ones, and what would make you need to get one over the other?
Mammography, we've seen changes in technology over the years, and it's so exciting where we are right now with the 3D. It was just kind of the technical word is tomosynthesis, but we just kind of use a layman's term of just 3D. It's easier.
Yeah.
Because it's when we can take a mammogram and kind of look through it and almost look at it in an almost 3D sort of way to kind of look through some of that dense breast tissue.
Yes.
And with this new technology, we're finding more cancers, smaller cancers.
Wow.
Yeah, it's really wonderful.
That is incredible. And so you don't start there though. Or do you?
So with the 3D mammogram is what we do for all of our screening exams. So it's standard now.
That's awesome.
And then mammograms are great because they can find a cancer before you can feel it.
Okay.
And they can also find cancer when it's just starting, when it may just be a few little specks on a mammogram that's just so small that it's not even a mass yet.
Yeah. So before that pain that brings you in.
Right.
Oh, that is so great. That's a very, like, almost a sigh of relief and comforting to know that there are ways to detect things so much sooner. What about coming in, like, for example, I had my first mammogram. I went to the mammo van and I loved it. It was very cool. They came straight to my work parking lot and I got to go out, and this huge, beautiful, I don't know if it was a fifth wheel or what, and they have all like a full facility in there, and they did my mammogram. And then I was referred to get an ultrasound this time around. And so when someone is looking to make that appointment, where do they call? Where do they begin? I mean, I'm assuming we can just come to our website. We will have those details there. But as far as facilities here at Centra, where is that available to them?
So for mammograms, for a screening mammogram, if you don't have any symptoms, you don't need a doctor's order. You can just make an appointment.
Oh, nice.
And just call and schedule a mammogram. So you don't need anything.
Yeah.
If you're having a problem and need a diagnostic, so you need a workup, then you would need a doctor's order. So you'd call your primary care doctor. We usually start the workup with a mammogram, but based on what we see with the mammogram or what's happening, that we may need breast ultrasound, which is a different way to look at the breast tissue. It's really good for breast cysts and looking at the ducts in the breast, the lymph nodes. So it's a slightly different way of looking at the breast. And then there's also breast MRI. So we have different modalities, and each one has its strengths and weaknesses. No one test is perfect. So sometimes if we see something on the mammogram, we may need an ultrasound just to see what that is, whether it's a cyst or a mass.
Okay. Yeah. I love that. So for those of you who are watching and you're wondering what is your next step, go to our website and search mammography. And there is a page there that has some information or just go to your primary care and ask questions. That's the one thing we talk about here on And So Much More so many times, is how important it is to have such a good relationship with your primary care doctor. And so I love my primary care doctor. And that's such a great question that I had with her when I just went back in September. And so it's important to get that ball rolling. It's important to listen to your primary care, but also to advocate for yourself and make that choice to do something that's so important for your body. And so thank you, Dr. Graham, for being here and for just helping kind of tear down these walls, pull back the curtain, and give us some insight on how to better take care of ourselves as women. I'm so thankful for that. And thank you all for listening to And So Much More.